Hi everyone and welcome to NU 121, Health Preservation. This is your second semester APU Clinical for Trocaire College. My name is Lindsay Porter. I have my Master's in Science of Nursing. I'm a family nurse practitioner, board certified by the ANCC. I have my BSN also from University at Buffalo. I just wanted to take this time to welcome you guys to APU, it's also known as the Academic Partnership Unit. Welcome to your second semester of nursing here at APU and to your clinical rotation at Mercy Hospital Buffalo. My name is Lindsay Porter and I will be your clinical instructor this semester. I just wanted to tell you guys congratulations, you've completed your first semester of nursing school, which is a huge accomplishment. You've gained foundational skills in long-term care settings, and now you're ready to take that next big step into acute care hospital environment. This transition is exciting, but it can also feel overwhelming at times, and that's perfectly fine. My role is to guide you, support you, and challenge you so that you can grow into the safe, confident, and compassionate nurse that you are meant to be. So let's discuss the transition from long-term care to the acute care setting. Where you've been and where you're going. In long-term care, the focus is often on providing consistent, ongoing support for patients with chronic conditions. You may have grown comfortable with routines, assisting with activities of daily living, providing comfort care, and developing relationships with residents over weeks or even months. In the acute care setting in the hospital, things move much faster. Patients are admitted, they're discharged with acute conditions, heart attacks, strokes, post-surgical recovery infections that require constant monitoring and timely interventions. You'll be expected to think critically, prioritize quickly, and communicate clearly with the healthcare team. This is where your foundational skills are vital. You'll use vital signs, communication, and basic care will serve as a launching point for you. But you'll also begin to integrate higher level thinking, such as critical thinking, connecting assessment findings with pathophysiology, anticipating complications, and applying evidence-based interventions. Think of long-term care as learning to ride the bike with the training wheels. Acute care removes those training wheels, and while it'll be right beside you, this is where you'll start balancing more responsibilities on your own as a student nurse. For those who are interested, this is my educational background. I have my ADN from SUNY Erie North Campus, my BSN from University at Buffalo, my MSN from Roberts Wesleyan University. Like I stated earlier, I'm a board certified family nurse practitioner from the ANCC boards. I'm a New York State Nurse Practitioner Association member. I'm ACLS, BLS certified. I have experience working in BMT, urgent care, float pool, CVICU, med-surg telemetry, and cardiothoracic surgery. I've worked as an RN at Cleveland Clinic, South Buffalo Mercy Hospital, Rochester General Hospital, and University of Rochester Medical Center. And currently I work as a clinical nurse educator for med-surg nursing at Catholic Health Per Diem. One of the best things you can do for yourself this semester is to set personal learning goals. When developing these goals, I want you to ask yourself, are there any skills that you want to improve? How can you strengthen your confidence in patient assessments? Do you want to focus on time management? Maybe communicating with healthcare team members, or maybe just understanding medications better. Once you identify your 3 goals, you give yourself direction. Without goals, it's easy to just kind of get through each clinical day, but with goals, you'll push yourself to grow intentionally. I'll be asking each of you to share your goals with me, and together we'll revisit them throughout the semester to track your progress. Clinical Judgment Model, also known as CJM. Another key component of the semester is deepening your understanding of the clinical judgment model. Nursing isn't just about doing tasks, it's about thinking. The model helps guide you through recognizing cues, analyzing cues, prioritizing hypotheses, generating solutions, taking action, and evaluating outcomes. This should sound familiar. Hint, hint, your concept maps. This framework mirrors real-world nursing practice. For example, if your post-op patient suddenly reports shortness of breath, you'll quickly recognize the cue, analyze possible causes, and take action, whether that's assessing oxygen saturation, positioning the patient, or notifying your provider. The more you practice using this model, the more natural and confident your decision-making will become. Hand in hand with the clinical judgment model is Maslow's hierarchy of needs, which you may remember from your first semester in acute care. Maslow's becomes your tool for prioritization through your whole nursing career. Patients may have multiple needs at once, but when time and resources are limited, which one do you address first? Always start with the physiological needs, airway, breathing, circulation, also known as ABC. Next, ensure safety and security, preventing falls, ensuring proper medication administration. Then you can move into psychological needs like belonging and self-esteem. For instance, if a patient is anxious but also struggling to breathe, you address the breathing first. Anxiety does matter, but it doesn't matter more than oxygenation. Learning to prioritize using Maslow's will help you organize your care and make clinical safe decisions. Finally, let's revisit the nursing process, which is the backbone of everything you will do in acute care and nursing. Think of it as your roadmap. Assessment, collecting comprehensive data on your patient. Diagnosis, identifying those nursing problems, not just medical diagnoses. Planning, setting measurable, achievable goals. Remember, SMART. Implementation, carrying out the plan safely and skillfully. And evaluation, reflecting on whether the goals were met and what changes are needed. Are they actually good goals, or do they need to be changed? Every single patient encounter in the hospital can be framed through this process. It keeps you organized, helps you collaborate with the team, and ensures that your care is evidence-based and patient-centered. Just some tips. If it's a sign, go ahead and do that assignment. Trust me. Didactic is just as important as clinical. Make sure you're studying what you don't know. It's always nice to study what we do know. We feel great, we feel confident. But if you don't study those hard topics, it's never going to get easier. For example, if you're having issues with pain in the adult patient, perhaps you should look up an article and read the article and watch some videos. Make sure you're staying consistent and also ask for help. So as we begin the semester, I want you to remember a few things. This is a transition. Give yourself grace as you adjust. Set meaningful goals and let me help you achieve them. Use a clinical judgment model, Maslow's hierarchy, and the nursing process as your guides. Most importantly, know that you belong here and you are totally capable of becoming the nurse that you aspire to be. At Mercy Hospital Buffalo, you'll encounter patients with diverse and complex needs. You'll have moments where you feel challenged, maybe even unsure, and that's all part of the journey and process. What matters is that you stay curious, stay compassionate, and keep learning. I'm so excited to walk alongside you this semester. Welcome to Acute Care Nursing. Let's get started.